1 in 70 revellers armed with knives, screamed the Edinburgh Evening News. The Guardian asked, who let the yobs out? In an article condemning drunkenness and alcohol abuse among youth in England. And then there is the widely perceived perception of moral decay. But perhaps that's the point, perception. We are told the youth of today are degenerate, violent, or drunken. According to Mori research, 71% of all news stories referring to our youth are negative. But there is an alternative view of Scotland's youth. 1 in 70 revellers carry knives, which means, of course, that 98.5% of youthful revellers do not carry knives. Of course, the 1.5% are a problem, but our streets are hardly awash with blood and weapons. However, it is also clear that most people have a false idea of how their peer group actually behave. When we look at potentially harmful behaviours, we need then to ask two simple questions. How do we really behave? How do we perceive our peers to behave? And these questions lie at the very heart of social norming. If individuals are made aware of the actual peer group behaviour patterns, will that reduce risk-taking behaviour? The answer appears to be yes. An approach that is based not on wishful thinking, but on a clear, rational model. An approach that seeks to include our young people in finding a solution rather than imposing a solution upon them. And, above all, an approach that rejects the negative and emphasises the positive. Most of Scotland's youth don't smoke, don't get drunk, and don't riot in the street inflamed with wild notions.
Scottish youth is actually moving in the right direction, and they need to be praised for that.
I rise to congratulate my colleague Dr Bill Wilson on bringing this important debate to the Chamber. I think this is an issue which really needs to be looked at in considerable depth. It's something which is quite innovative, and I really do think it's this kind of thing that the Scottish Parliament should be doing more of. And that's why it's important the Bill highlights that it's not what a lot of students do. A lot of young people are extremely concerned about their own future, they're extremely well behaved, they actually care about their society, they care about the planet, and they care about lots of things, and they don't want to smoke their lungs out, and they don't want to drink themselves to death, and they don't want to take drugs.
I did in fact find this research much more interesting than at first glance. There does therefore seem to be a genuine misperception on this issue, with the end result being that the alcoholic intake of many is being increased, as they see it, to keep up with their peers who are drinking less than they are. So I hope that this research will be utilised to underline any public health messages, advertising and information campaigns for students and others.
May I begin by congratulating Bill Wilson for submitting such an interesting and potentially highly beneficial motion to Parliament. I'm always surprised by how many times grown adults exaggerate and embellish their own behaviour, even their own mild misdemeanours. It appears that we do not only exaggerate, but that we believe in other people's exaggeration. The fact that social misconceptions may lead to increasing consumption of drugs and alcohol is surely something that we should seek to tackle. And I therefore thank once more Bill Wilson for bringing this motion to Parliament, and I am more than happy to commend it to this Chamber. There's nothing easier for people to get a grip of than facts and figures. And it's also all too easy for the media to twist those facts and figures in a way that suits the story that they particularly tell. So, like other speakers, I also welcome Bill Wilson's efforts in bringing this methodology to our attention, and I would hope that the Minister and Cabinet Secretaries will take this forward as another tool.
Points that we should all remember. One is that the vast majority of young people are law-abiding citizens and responsible citizens at that. And I think the other is that good news doesn't always make good headlines, or quite often doesn't make good headlines, as Richard Simpson said, and that is something that we have to look at in terms of how we deal with the media. And I think we all recall feeling pressure as young people to sit in with the crowd. But in the United States, what these social norms programmes have exposed is that the reality of the crowd's behaviour can be misunderstood, and that such misconceptions can reinforce negative behaviours such as binge drinking or smoking, as members have said. We are determined to achieve a healthier Scotland, and nothing is off the agenda to help us get there. And I think tonight's debate has been a very welcome contribution to that. Thank you.